While obesity can be considered the harbinger of future health disorders, it is said rather to be a marker of metabolic syndrome, not a cause of it. Metabolic syndrome affects over 25% of the adult population, and children with obesity have an increased risk of metabolic syndrome as adults. Let's take a look at metabolic disorder in adults and children. Basic causes of metabolic syndrome. Metabolic syndrome is a group of heart disease risk factors that raises your risk of diabetes, heart disease, and stroke. Various alternative names for the disorder exist, such as Syndrome X, insulin resistance syndrome, and dysmetabolic syndrome. More than 1 in 5 Americans have metabolic syndrome, according to a national health survey. Metabolic syndrome affects more than 40% of persons in their 60s and 70s, and its prevalence rises with age. The American Heart Association (AHA) describes metabolic syndrome as a cluster of metabolic disorders that includes high blood pressure, high fasting glucose levels, and abdominal obesity, which, combined, increase the risk of heart disease. Being overweight, obesity, and inactivity are all intimately related to metabolic syndrome. Additionally, it has a connection to insulin resistance. Normally, the things you eat are converted to sugar by your digestive system. Your pancreas produces the hormone insulin, which facilitates the entry of sugar into your cells for utilization as fuel. Cells in persons with insulin resistance don't react to insulin as they should, which makes it harder for glucose to get into the cells. Because of this, even when your body produces more and more insulin in an effort to lower your blood sugar levels rise. So what causes metabolic disorder? Metabolic syndrome is a group of risk factors that frequently occur together rather than an illness in and of itself. When a person exhibits any 3 or more of these symptoms, they are said to have metabolic syndrome. Central obesity, where the majority of body fat is concentrated around the upper body and abdomen. It is said to be central obesity. The bigger your waist circumference, the larger risk. The likelihood that someone will develop central obesity varies according to their gender and ethnicity. Generally speaking, you need to lose weight if your waist measures 94 centimeters or more for males or 80 centimeters or more for women. Risk factors for metabolic syndrome include obesity and a sedentary lifestyle. Some of these comprise excessive blood pressure and insulin resistance, which we would talk about later on in the video. Whether it's for you or a loved one, subscribing to our channel brings you closer to the latest updates on health, nutrition, treatment, and more. Cholesterol and triglycerides. We produce cholesterol in our livers, which is a fatty material. Low-density lipoprotein, LDL cholesterol, can clog arteries by accumulating on blood vessel walls. High-density lipoproteins, HDL cholesterol, offers some defense against the accumulation of fatty blockages. Triglycerides can be found in the foods we eat, but they aren't produced by the liver. Excessive alcohol use may cause triglycerides to rise. Triglyceride levels are likely to be greater than usual if you have insulin resistance. Low levels of HDL cholesterol, also known as good or protective cholesterol, are frequently linked to high blood triglyceride levels. High blood pressure. When a person's blood pressure is more than 140/90 millimeter of mercury, hypertension develops in the absence of other risk factors. Genetics, certain living styles, or other illnesses like kidney or cardiovascular disease could cause this. Your chance of getting cardiovascular disease, stroke, and kidney disease is also increased by high blood pressure. Although everyone is unique, the optimal blood pressure range is less than 130/80 millimeters of mercury or lower if other disorders are present. Find the best target for you by seeing your doctor and ensure that your blood pressure is monitored frequently. Even though medicine is occasionally necessary, moving on shortly, we will let you in on some lifestyle adjustments, including regular exercise, quitting smoking, and maintaining a healthy weight, equally important for metabolic syndrome treatment. Insulin resistance. Insulin resistance is a condition where the liver and muscles in particular struggle to use the hormone insulin as well as they should. Normally, glucose is created during the breakdown of carbohydrates by your digestive system and is subsequently absorbed into your bloodstream from your intestine. Your pancreas releases insulin into your bloodstream as your blood sugar levels rise. Glucose from your blood can enter your muscle cells thanks to insulin. Once inside a cell, glucose and oxygen are burned to create energy. In order to maintain normal blood glucose levels in a person with insulin resistance, the pancreas must generate and release more insulin than usual. It's estimated that more than 25% of people experience some level of insulin resistance, eventually leading to metabolic syndrome. Endocrinologist Betul Hadapoglu, MD, says that people with metabolic syndrome have a risk of heart attack and stroke that is double the risk of people who do not have metabolic syndrome. That's the official statistic. In my opinion, the risk is much higher. Now let's take a look at some ways you can reduce your risk of metabolic disorder. With lifestyle changes, it is frequently possible to address early lipid and cholesterol problems, high blood pressure, and excessive blood sugar levels. When they are diagnosed with metabolic syndrome, some people may already be on medicine for a particular complication, like high blood pressure. So the initial goal of diagnosis is to pinpoint individuals who may be at risk for metabolic syndrome, but who would benefit more from lifestyle changes than from pharmaceutical interventions. Include as many healthy lifestyle adjustments as possible and consume a lot of fresh produce, whole grains, and fruits. Reduce your meal intake and avoid foods heavy in fat or sugar to aid in weight loss. Reduce the amount of saturated fats in meat, full-fat dairy, and many processed meals. Regular exercise can come in various forms, depending on what works best for you. Try to exercise for at least 30 minutes daily for at least 5 days a week. Maintain a healthy weight and avoid smoking as it raises your chances of lung cancer and cardiovascular disease, especially if you have metabolic syndrome. Quitting smoking will have numerous positive effects on your health. Although lifestyle modifications are crucial for the management of metabolic syndrome, there are situations when medication may be required to treat the various problems. To determine the best management approach for you, speak with your doctor. Thanks for watching today's video. Hope it was helpful. Head on and watch this video, Foods for Treating Low Blood Sugar. Best snack for low blood sugar, for more insight on your health.